right, so our next section is titled Advocacy and Guardianship. And we're very excited today to have Corey Merchant here from the Colby Act. We have Bob Cornelius and Andrea Mixon. And I'm going to give them a chance to introduce themselves, and then we'll start with you, Corey, and your video.
My name is Corey Merchant, and I've been part of a supported decision-making model that with a family here in Alabama, Colby Spangler. So as most of you probably know, we officially don't have supported decision-making as an option in Alabama yet, but we're hoping that does become an option. So I was approached by Colby's family to see if I would be interested in working with a team around that model. So here's my notebook that tells me exactly when we kind of started this, which is 2 years ago. So that'll be my contribution, so I can answer questions how it's looked for me to be part of that team. The Colby Act, and hoping to move supported decision-making as an option here in Alabama. That the video talk a little bit more about that.
Hi, I'm Andrea Mixon. I'm an attorney at the Alabama Disabilities Advocacy Program. I primarily work with children with disabilities, but also work with transition-age adults, and also work with adults who are seeking employment, who are on Social Security benefits. So I see a lot of the prep work that goes into getting a person to living the most independent and productive life as possible. But I'll make a comment real quick. It's in our world of individualization. You think a lot about individuals, independent education plans, individual plans for employment. The list goes on and on. But when we get to thinking about adulthood, we don't sometimes think about individualization. And that comes into play more when you think about how easy it can be for a court system or for a family who may not know all the options to think that guardianship is the only option. So I'm looking forward to talking a little bit more with you guys about that.
Hi guys, I'm Bob Cornelius, and I'm here. I handle primarily the transition from moving children from the school system out into adulthood. The question, do you need guardianship? Not everybody does. Do you need conservatorship? What's the difference? That's what our law practice pretty well handles and deals with. We also handle a multitude of other issues associated. I've been involved in IEP plans and all this, but children, while they're in school, is not really our cup of tea. It's after they get out of school and are transitioning into adulthood, the services that they might have. We're an independent law firm, and we handle, like I said, primarily, you'd refer to elder law and special needs. Everybody says, why elder law? Why do you throw that out there? Well, it's as simple as this. You're born with a special need. You have an accident as an adolescent and you're a special need. And if Lord willing, you age until you're a special need. It's all the same legal efforts and things that we need to do. So, and I'll be here to answer questions about any of that area. And I'm also a huge advocate of the Colby Act because we need alternatives in the state of Alabama for guardianship. Like I said, not everybody needs full guardianship. There is limited guardianships, that's fine, but we need another alternative that, especially if the child or adult has the mental capacity to help with their own decisions.
All right, perfect. So we will start the video now, and if you want to cut the light.
Colby likes to ask questions. He's determined to find the answers.
I like to ask why a law.
The one question I can't answer for him yet is why he was born with cerebral palsy. I knew he was going to be challenged in life after receiving the diagnosis, but I was not prepared for the constant battles we faced to get the services and supports he would need. To see how much he's already overcome speaks directly to his determination and perseverance to seek solutions.
I like to bring bid.
After an end-of-the-year band concert in high school, the seniors were recognized for their accomplishments and announced their upcoming plans to attend college. Each senior proudly announced the name of the college they had chosen. So of course on the way home, Colby asked,
Where am I going to college?
and that was a question I was not prepared to answer. So with a knot in my chest, I said, I'm not sure yet, but we can look at some online, okay? We learned about 8 college programs, and all of a sudden, a whole new world of possibilities had opened up for Colby that we had no idea even existed.
I can do this.
Colby started talking about college in his IEP meetings, and they listened. And it wasn't easy at first because the more we learned about these programs, we realized there were certain criteria to meet for acceptance. And one of those was that Colby needed to remain his own guardian. Some programs required it, and some preferred it. That's when we learned about a new phrase called the School to Guardianship Pipeline. Many schools unintentionally steer students like Colby to seek out guardianship when it's not necessary.
I know I can choose for myself. I don't need a guardian.
The advice was well-intentioned, but if we had taken it and become Colby's legal guardians, he would not be where he is today. Now he's in college and about to graduate.
In college, I have mentors and friends who help me with different things.
Colby lives an hour away from home on his own now, and we quickly realized he deserves this level of independence, and that if it's going to continue, we will have to step back and let go more every day. That is really hard for me. So I do what most moms do when we get scared or unsure and we just want to protect our kids. I went into detective mode. I went online, I did some research. I reached out to other moms who've been there, done that with this age and stage. That's when I learned about something called the supported decision-making model. And in my research, the Alabama Council for Developmental Disabilities introduced us to something called charting the life course tools. I shared this information with Colby and he liked it too. So we put these two ideas together and created Colby's Dream Team.
I love my dream team.
We have some amazing people contributing to Colby's Dream Team. They are all experts at what they do and mutual friends who know Colby pretty well. The value of building relationships outside of a network of paid supports has been vital for Colby's success. With more natural supports comes more independence. The outcomes we've seen from his relationships with these team members create more opportunity for inclusion at an exponential rate.
We get by with a little help from our friends' wife.
One very important relationship we've built through the years is with Alabama's Disability and Advocacy Program, or ADAP. Our friends at ADAP know the long history of the fight for rights for people with disabilities. ADAP works closely with our courts on issues related to guardianship in Alabama. Everything Colby is doing right now is making a huge difference for guardianship reform. I'm incredibly proud of Colby, and I know he's paving the way for many more to come. I know a big part of the answer to his why is to keep asking others,
Why not? Let making Colby happen. Help us bring team to Alabama.
So I was asked to be on a panel at a conference a few years ago, and I had several people from other states on the panel with me, and they kept talking about supported decision-making being part of the transition plan and having this notarized document where an individual could, ask for a caregiver to also be able to have access to their health records and whatever level that the individual wanted to have someone help with medical decision making. And I thought, do we have that in Alabama? I haven't heard of that. So I start looking on the supported decision making website and really start trying to search that out. But it was a new concept to me living here. And so, Corey, would you start with just kind of explaining what supported decision making is?
So for me, when I was invited to participate in this model project with Colby's family, at first I was like, ooh, I don't know, what does this look like? And of course, Kim being who Kim is, she provided this wonderful binder that she mentioned in the video. And what I realized really quickly is it was very intuitive. I think everybody in the room, we have that person, right? So for me, if I have a medical question, I'm lucky that both of my college roommates are, they're both nurse practitioners, so that's who I call. If I have a financial question, I have somebody that's kind of, they're in my phone, that's the person I call to ask those kind of questions. If I'm on Colby's team, I filled the role of advocacy. So if I'm looking towards, those kinds of topics for myself, I have that person in my phone that I call. So it's really intuitive. So right away I was like, well, this makes complete sense that Colby would just define who those people are and how they support him. And so we know our roles and he knows the role that we play, and then he can reach out to us for those particular areas. So let me give you an example. During the last presidential election, he called me and asked me, Corey, can we sit down? I really want to talk about the way that I'm thinking about voting. And I said, hey, let's sit down. Now, it's not my role to tell him who to vote for, but it's my role to talk through that and say, well, if you considered this, if you considered that, if you looked at their platform. Recently, he had some healthcare issues, or not issues, questions. So immediately, instead of calling his parents, he had someone on his team that he knew he could call, and they would help guide him through that process. So for me, it's been a big learning lesson. I should say that I also have a son who is 12 who has Down syndrome. And so for me, learning about this model through working it with Colby and his family has been eye-opening, because I can now think, okay, who might fill that role for my son as he exits high school? Thinking about who do I want those people to be? Who does he want that person to be? Maybe I shouldn't be so in charge of all these decisions. So that's been my role. It's been an incredible experience. We meet quarterly, but Colby calls when he has questions. It's this binder is it walks us through all the different topics. It walks Colby through that. And so, my part in this is having walked through it and now worked with Colby and his family, I believe it's time to bring supported decision making to Alabama as an option, an alternative, not in place of the things that are there, but for individuals to feel supported and know that there's a structure, for our courts to know that there's a structure and what that looks like. So that's kind of my experience.
Yeah, I would just add that the kids that I've worked with, and I've done hundreds of IEP meetings through my career, and it's all, and I'm preaching to the choir when I say this, that there really is not the fulsome emphasis on transition services kind of writ large, but in particular, there's really not a discussion of what are those rights that we as individuals, as students have in our life, and what are the different options for independence once we graduate high school. We put, like I said, we put such an emphasis in education on being individualized, but we get to a point, and the most important point of the student's career is graduation and transition, but yet we sometimes fall back to a very parental role that we don't necessarily want our children to live in for the rest of their lives. We want them to be able to make some decisions for themselves. And so, looking at from, preschool all the way up to high school and college, there needs to be a greater emphasis on supported decision making. And at ADAP, we're here to help you walk through that process with you. We hope that this legislation that was introduced in March, which really would kind of put the the government stamp of approval on supported decision-making as an option in lieu of a limited guardianship or guardianship. That's going to be reintroduced, I believe, hopefully, in the fall, in the next session. So it's a very exciting time and to be here. And I think, having you guys know about this right now will help us and help you as we, push to advocate for the passage of the legislation.
Guys, am I on? Okay. I handle guardianships through the probate court weekly, okay, multiple guardianships. The first thing I want to say is, as I said earlier, not everyone needs one. It doesn't, at least not a full guardianship. You might need guardianship for finances, help them with their financial information. May need a guardianship specifically for housing or specifically for medical decisions. You don't need necessarily a full guardianship. Now, I want to emphasize to you that when you read articles on the internet, in newspaper magazines, often these articles will refer to guardianship and conservatorship as the same thing. And that depends on what state you're in. In the state of Alabama, we separate the two. Guardianship on one hand, conservatorship over here. Our children coming up through the system, if they've been through the special ed programs, not many of them are likely to need conservatorship. That's not the same thing as Social Security payee, okay? That's income coming in. Conservatorship would be over assets over here. So before you just run out there and think, I gotta have a guardianship, think it through, and I would try to help you think it through. Is there another alternative? We desperately need guardianship reform and conservatorship reform in the state of Alabama. Right now we have a court-appointed conservator. That's one person handling a lot of people and a lot of money, okay? But there's no such thing as a court-appointed guardian that's grouped, like county-wide or statewide or whatever. Parents can get appointed, family friend could be appointed, a brother or sister could be appointed as the guardian or limited guardian. So I just encourage you to think and ask questions before you just run out there and say, well, I read this article says this, I think we're going to need it. Now, don't get me wrong. There's a lot of people that need full-time guardians. In fact, just in the central Alabama area within our group homes, there's more people without a guardian that need a guardian than there are people with a guardian. Now, if you're a guardian of your child and they need one and they have to go live in a group home, you're still the guardian, okay? You don't give that guardianship up just for that, even if it's a limited guardianship. You don't give it up just because they go to live with someone else, go to live in a group home, or something of those natures. So that's kind of what I wanted to do today is separate guardianship, conservatorship, and get people to think about the alternatives if they're possible. Sometimes they're not possible. So you've got to separate those people. Nobody knows the abilities of their child better than mom or dad. Okay? So when and there is a parental guardianship that you can now get that's less costly. It can be done away with if we need to. If they need it at 19 and you don't need it at 25, it's easy for the parent would be to step down. Full guardianship of another person, that's a different story. That's a little harder. And conservatorship, if you had it, is even harder to get rid of. Okay? Conservatorship is that situation with over the money. But I'll be happy to answer questions.
Okay, so I think that's a good place to answer while you've got the microphone. So let's talk about the different options. So all the way from full guardianship down to supported, what is legal, what are the options, what do you recommend on when people start thinking about that?
First of all, you need to ask yourself the question, can my child, do they have the mental capacity to enter into a contract? Could they go buy a car, for example, or sign a lease on an apartment? If they can't, you may be in the position you need full guardianship. Full guardianship says they take away all their rights. They can't right to marry, right to vote, right to open a bank account, all of those things. They're incapacitated. Now, a lot of people will think for a second that, well, my doctor says my child's incapacitated. That's not a medical decision. Only the court, probate court, can declare someone incapacitated. So that's the first. Can they sign a power of attorney and know what they're signing, know what they're giving up? If they can, that power of attorney will work just like guardianship will. Okay? No problem. A lot less expensive. A lot less expensive. But that's number one. On the second level there is you can have the payee. If the only issue you have is taking care of their income, their Social Security check, you can have a Social Security payee. If that's the only issue you have. The one thing you've got to watch long term is an accident. And they're not with the parent and they rush them to the hospital. Okay, they're in an accident, they rush them to the hospital. They're now 30 years old. Mom, dad rush into the hospital and, well, are you a guardian? No, I'm a parent. Well, you can't go back just yet. We got to wait a minute. And until they get approval from some obscure hospital board, Mama can't go back there. We don't know how bad they're hurt. So that's when you get into a crisis. That's when we're rushing down to the courthouse trying to get temporary guardianship, which is more costly than just regular straight on, where if you handled it up front, you don't have those issues. It's a hard decision for parents to make. Do I take it? Do I not take it? I have guardianship over my son, have had since he's 19 years old. He functions at about mentally 3. He don't know what money is. He don't know what, anything is. I mean, he's mobile, but he's not with us. You need full guardianship in that scenario. He don't know what voting is. He don't know what marriage is. It's totally, for him. Whereas I've got clients with limited guardianships to help them handle their finances, to keep somebody from taking care of them because they got a big inheritance at one point or something of that nature, which usually winds up either in a conservatorship or a special needs trust. And that opens up another Pandora's box.
Okay, does anybody out there have questions about any of that that's been mentioned so far?
Sorry, it kind of goes back to the first woman who spoke. I just wanted to see, is there a copy or a guideline that was used for that binder, and can we find it and use it?
Yes, so I wish y'all could see. I'll be glad to stick around and let everybody see it. So it's Charting the Life Course is the name of it. And it's literally color coded, and we each have our own tab as to what our responsibilities are. And it's updated regularly when we get together for our quarterly meetings. I get new sheets that kind of take place in the binder. But it's charting The Life Course is the name
That'd
of
be
it.
great, I think, for each family to have a team, no matter
Yeah.
what you're
Oh,
doing.
absolutely.
I'd love
Absolutely.
to know the different people and people
Right.
I should get on my team.
Right, absolutely. And start thinking about that. For me, with my son being 12, I've already started thinking about this as we were talking about through that IEP process and thinking towards transition. You know, who do these people look like? Is there someone, Colby's team, there's someone from his high school that's on the team. He has a peer that's on the team, somebody he grew up with that helps him with the social aspects. So for me, it meets all the different needs. Now, it's not for everyone, but in Alabama, it's time for us to have that option. It's time for us to give that option to individuals, so that, in my situation, we're fighting for the individualized education plan, and then I'm just supposed to hand it all back or take it all back the day he graduates. It's not for everyone, but let's have it as an option.
I have a question. Can you talk through, I guess I need the basics of why the need for the law? What does that change? What does it resolve? Why would you need it?
Right. So for the attorneys on the panel can probably speak to it a little better than I can, but as of right now, supported decision making is not an option it's not recognized. It's not recognized as an option for outside of the guardianship or the limited guardianship. It's not an option through the courts. So when the individual turns 19, supported decision making is not an option we currently have in Alabama. So it's not recognized. So for Colby to have someone that he reaches out to or talks with about health things, he can sign basically a power of attorney that allows him to have that person that can speak on his behalf in a medical emergency situation that's outside of his parents, right? So we're recognized in those different roles. So they can probably speak to more about how it looks when at the courthouse or the legal part of it.
Because you're already doing it, it's just informally.
Yeah, so we're doing it, really, we did it as a model. Like, how does this look? How does it work for Colby? Does it work? And it does. So we're kind of, I guess, the pilot program, I guess you'd want to look at it, and we said, let's do it. And now we can speak to it, and now with the Colby Act, we can speak to, hey, it does work. It's worked for Colby, it's worked for the family, it's worked for us as his supported decision-making team. So that kind of led to the actual writing of the Colby Act to bring supported decision-making to Alabama as an option.
And I'll let others talk more in depth about it, but there are certain parameters of what a support person can and cannot do.
It outlines it,
ethically and morally and professionally. What they can't just go off and make their own decisions outside of the wishes of the person that they're supporting. There's things that if they're in, they find that they've abused their commitment to this particular individual, then that could be a consequence. And there may be a need that at some point in time for a guardianship, and those players come before a judge for a hearing to discuss, and the judge listens to the team who's been working with this individual as to whether or not maybe a guardianship would be appropriate or not. So.
In many cases, I truly feel like a real life example speaks louder than I can ever speak, okay? I'll tell you about a real client, 63 years old, cerebral palsy, severe cerebral palsy. He can't feed himself. He can't write. He can't even roll his own wheelchair. Just recently, we got a motorized wheelchair, and he's got enough movement with a finger or two fingers to be able to get around the apartment. He's got a speaking device. He could pass law school. I mean, he is smart. He's with it. He just can't make it happen, okay? There's no alternative for him but guardianship. He don't need guardianship, okay? He can make his own decisions, and he can talk. He called me the other day. Now, it's a challenge on the telephone to hear him because he speaks, then it's translated and it comes out in a kind of a monotone voice. But we can communicate his needs and wants. But right now, without the Colby Act, there's no alternative for that. Take the sign and flip it over to my son. My son, the Colby Act would not fit in one iota. I mean, it just nothing about it would he have. Now, does he have his support group? You betcha. We know these different people that handle different things in his life, and we do it informally though, okay? But it's got nothing like to the level the Colby Act would allow the option for families. So I encourage you, pay attention to this act, House Bill 522. I think it will be the same number when it's
It may have to be reintroduced, which would change the bill. Right now, we have one sponsor, Gil Isabel, which is, I believe, in the Gadsden area. So when this bill comes back up in the next legislative session, we would just encourage you to reach out to your representative and say, I would like for you to support this bill. Let's move this forward and let's get it passed. I mean, that's the main thing, is we need more sponsors to the bill, but we also need the public and their constituents to say it's time to move this forward and have this option in our state. We're behind, quite honestly, in not having it in Alabama,
So
having it as an
in
option.
the healthcare setting, because it's not recognized legally, from the healthcare side, there's guardianship or there's nothing. And so COVID really kind of shined the light on why this is so important, because you have an adult health system and a guardianship's not in place, and there's a no caregiver policy, and the individual hasn't said, yeah, but I really need a caregiver with me. I'd like to have a caregiver helping me make decisions, and there's not a legal document in place making that happen, then it's really a barrier and caused, honestly, COVID shined a light on a lot of things for us, but this was one of the glaring things that was really there, that we need a legal court-recognized document in place that says, no, this person doesn't need full guardianship, but they do need support, and they do, and as a person, they can say they need support and name who that person or people are, and those people can be present for their care and for their decision-making.
Guys, I've been at this long enough. I've seen just about everything I think that can happen, and tomorrow I'll see a new one. But I've had a child in an accident at a group home, rushed to the hospital by ambulance, and it took mother 2 hours to get permission to go back to see him because she wasn't his guardian. And he did not function high enough to be a part of this, okay? But that's why it's a confusing area right now in Alabama. We need that reform so that the court judge has an option. If we bring up a guardianship petition, and it may reach the point we have to bring the petition, that the judge says, no, I don't think he needs it, but the petitioner sitting back here saying, well, how am I going to do this, this, and this? Judge's got another option. I mean, it gives the authorities the ability on the legal side to order something else.
Corey, can you say the bill number again? Somebody back here.
It's 522.
Yeah, it's HB 522.
And it's listed as the Colby Act. So if you Google or put in Colby Act, or you go to the state's legislative website and put in Colby Act, it'll pull it up and it'll pull the actual full written act up for you. We had hoped to get it introduced this last legislative session and move it forward, but as things go, it's going to happen. We just need more time, and obviously we need people to co-sponsor it. We need people to come on board and talk about it with us and move it forward.
Yeah, it will be. You will have co-sponsors jumping on board here.
Right.
But guys, when we say contact your congressman or your state house representative or senator, they do pay attention. Okay, I can assure you, they pay attention, and they're all looking for good causes to get behind. Let's give them a good cause.
Anybody else have any questions about guardianship? Okay, so what happens if someone doesn't do anything and their child turns 19 and let's say they're still being followed at Children's Hospital? What happens to medical consent? What happens?
Until something happens, nothing. You can have a child get on up to age 25, 30, 40, okay? Am I still on? I feel, okay, I gotta put it closer. Nothing happens. You're still mom. You're still dealing with everything until there's a crisis. A car wreck, fall, an accident, something that rushes that child into the medical community. I've had someone with a 60 IQ that was raped. I hate to go there, but it was raped. When they got to the hospital, the girl said, no, I want to talk to the doctor myself, and would not let her mother go back. The doctor couldn't talk to the mother. Just little things that until there's a crisis, nobody pays attention. That's why we want to do the education programs, to get you thinking so we can avoid the crisis issue. Because we don't need to run down to the court and pay an extra $750 or $1,000 to get in front of a judge pronto. Okay? That's just the Jefferson. You can't file an emergency guardianship in Jefferson County without a doctor's letter and a $750 check.
When should people begin thinking about which path is right for them and who should they talk to?
I would say you should start thinking, when you start thinking about guardianship, you really don't need it until you're 19 years old. 19 is the legal age in Alabama, okay? So approaching 19, began to think, okay? Somewhere between 18 and 19, if you think you need guardianship, go ahead and apply, get it in front of the court. Because now, I'm not speaking of emergency. You need permanent guardianship or limited guardianship to some extent. Because it may take us 6 months to get a court hearing to get in front of the judge. Okay? So you don't want to wait till they're 19 and then do it, right? You've got a gap there, something happens. Start a little bit ahead, maybe 8 months. There's no rule of thumb, but it takes about 6 months right now. If I file today, it's about 6 months out to get in front of a judge.
What's the difference between full guardianship and limited guardianship?
With the limited full guardianship, permanent guardianship, it covers everything imaginable. You're the parent, again, and you've got a 2-year-old, and all the rights, and they don't have any real rights unless you allow them, okay? Same thing does with the full guardianship. A limited guardianship, you have to decide what you're taking guardianship over. Finances, housing, marrying. What do you need guardianship over? That's limited guardianship.
All right, well, thank y'all so much. This has been really informative, and if you guys think of other questions, I'm sure they're going to hang around for a few minutes.
I'm going to be around for a few minutes, but before we go, I want to address something that came up a little bit earlier when we were talking about the community-based waivers. Guys, I'm going to tell you a story that I lived through with my son. Okay, I don't care what kind of waiver you call it. Community-based, IDD, elderly and disabled. I don't care what the waiver is, and I didn't know. But you get your child on that list as soon as possible. okay? I don't know. Years ago, when I told you, my son's 43 years old, when he's finishing school and about to age out, I'd never heard of a waiver. And come to find out, his first grade teacher, without my knowledge, put him on the waiver list. By the time we needed it at 21, he was eligible. Then they stopped it from doing it at age 6. They forced you to wait to age 10 and then age 12. And that's because there's so many people on this waiting list. Okay? But let me tell you what this waiting list did as time went on. I mean, once he was approved. We started him at age 21. He went to a private school, Glen Iris Baptist. I don't know if any of y'all are familiar with it. But he was able to ride the bus back and forth. And they paid for someone to meet the bus in the afternoon at 3:30, 4 o'clock, stay with him through supper, give him a bath, feed him, get his medicine, and would leave. And then I could put him to bed. That goes on for several years. He outgrows the school. We changed the waiver, and he comes here to it's United Cerebral Palsy, United Abilities today. I still have a hard time there because I go all the way back to North Birmingham, okay? But United Abilities. And he stayed here for 4 or 5 years. And now, because that waiver had changed from this waiver to this waiver. He got sick. Actually, it wasn't sick. He had to have minor surgery. And in waking up from minor surgery, because for you or I, they had laid us on the table and slit our wrist open and taken something out. For him, they had to put him to sleep. Waking up from that anesthesia, he vomited and aspirated the full force back into his lungs. When I left the room, he was blue and he was gone. Okay? We were still in the hospital. Anesthesiologist was still on board, still on the floor. CPR got his heart back. Got him on the ventilator. For 15 days, we stayed on the ventilator. We stayed in the hospital so long, he became immune to all antibiotics. And he comes down with MRSA. Nothing else the hospital could do. So we send him home with hospice. Okay? So we changed the waiver from the UCP waiver, or whatever waiver that was, and I don't even know. But they've changed the waiver from going over here to the work program and the transportation that was involved, to having an LPN that came in, plus hospice was all there, but an LPN that would come in 5 days a week, 8 hours a day. He recovers. He gets home, he bounces back. He's still with us today. But when we're back, I start talking to the 310 board. Well, when do you think we should change this and go back to United Abilities? Oh, we're not. We're going to change the waiver again. So we changed the waiver to home care. And so he stayed at home with a full-time caregiver. Okay? As the years passed, we wound up going from that agency that they told us we could pick one of these 5 sitter agencies or caregivers to self-directed services. And I am now the employer, and I hire my own caregivers, and he can stay at home. He can get in the car and go with them to Bass Pro Shop or the mall or out to eat, whatever he wants to do. And I pay the caregivers. They come in, sign out, state gives us, we can pay them up to $17.32 an hour, but I'm the employer. I'm the employer, I'm called the EOR, Employer of Record. But when y'all hear these people talk about all these waivers, don't get confused. Just get on the list, okay? Because as time changes, they're going to change this, and they're going to call it something else, and they're going to alter this, and they're going to, whatever is under this waiver is going to be under something else waiver, and all these different things. Just get on the list and let the future handle itself. Because if you're not on the list, you're not going to get served.
All right, very good. Thank y'all so much for this panel. We have made it, y'all, to the last session of the day, so if the speakers for session 6 will come up. I've got, I know Melissa Hall and Dr. Lances here, so found them. I was right here a second ago. Important topic, and Melissa's brought some awesome, I see her table over there full of some awesome resources for all of you. So I'm going to hand it to Dr. Lanza first and let you introduce yourself, and then if you'll just pass it down and everybody introduce themselves, and then we'll get started.
Hi, I'm Robin Lancy. I am professor in health behavior at UAB. I'm here in my role with Lakeshore Research Collaborative and the National Center on Health, Physical Activity, and Disability. Kalani's going to introduce herself, and she and I work with Dr. Jim Rimmer.
Hello everyone, my name is Kalani Upshaw, and I'm a community health educator with the UAB Lakeshore Research Collaborative. Hi, my name is Jordon Kennon. I am the postdoctoral fellow at Spain Rehabilitation Center in Rehabilitation Psychology.
My name is Melissa Hall. I'm with Partners in Policy, Alabama. Also, I'll be giving some information, if you don't mind, about Social Security, DD Council, and some other things that might pop into my head. Okay, will do. Thank you.
All right, so we're going to start the presentation that Dr. Lancy has.
Hello everyone, today I will be talking to you about some mental health resources that we provide in the ADAP and the UAB Lakeshore Research Collaborative. Next slide. So mental health. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act, and determines how we handle stress, relate to others, and make healthy choices. And ultimately, it's important at every stage of our lifestyle, through childhood, through adulthood. Next slide. So adults with disabilities report frequent mental distress almost 5 times as often as adults without disabilities. And it's important that if you notice yourself experiencing mental distress, to call your doctor if it's interrupting your daily routines for 14 days out of 30 days. Next slide. So 1/3 of adults with disabilities report experiencing frequent mental distress, and mental distress is defined as 14 or more days reported mentally unhealthy days in the past 30 days according to the CDC. And this is associated with poor health behaviors, increased health services, mental disorders, chronic disease, and limitations to daily life. Next slide. So the National Center on Health, Physical Activity, and Disability, also known as NICPAC, we offer a Mentor, which is a program, a free 8-week wellness program designed for people with mobility limitations. And through this program, it's completely free and it's offered virtually online through Zoom, where you meet with your health coach, and you will meet 5 times a week for 1-hour sessions. And each session will focus on mindfulness, exercise, and nutrition, and also one-on-one with your health coach as well. So through this, you'll learn multiple ways life can be enhanced through the mind, body, and spirit. So we take a holistic approach through this program, and we focus on cultivating an improved sense of mental, physical, and emotional health. And and we focus on 11 element wellness domains as well, known as the My Scorecard. And the My Scorecard includes mindfulness, self-care, core values, outdoor times in nature, relationship building, exercise, contribution to others, arts and leisure, rest and relaxation, and also diet. Next slide. So again, the mentor program offers 11 element domains that you'll focus on throughout the program when you meet with your health coach, along with your mindfulness classes, where we provide you with free journal, where you do journaling as a group with your class, and also exercise courses where we provide you with free equipment, and we coordinate the exercise classes to meet your needs. Next slide. So if you're interested in registering for Mentor, you can scan our QR code on the screen, or you can go to mentor.mcpad.org and you can click Enroll Today at the top of our website and create your account. It's a few easy steps. You just put in your name, email, and create a password, and someone will contact you within 3 to 5 days to confirm your eligibility, and they'll ship out all the equipment that you would need for the program and so forth.
Can I add something real quick?
Yeah.
I think this is beneficial. Kyle is a 2-year mentor, big fan mentor. During COVID, when everything was shut down, Kyle, we had so much fun with Mentor. We did cooking classes in our house. They would ship everything to us. We had exercise. We did cool mindfulness meditation. It was a life changer during COVID, and the mentor people made it so much fun, and it was so inclusive and engaging for Kyle. Even if you think, well, how can my son or daughter participate? They don't use words to speak. It's, they're but they included Kyle in everything, and we continue to go to Mentor every other Tuesday. So I highly encourage you all. We like Mentor when we come. Yes.
And Kyle is part of the coffee club, right?
Yeah, we're part of the coffee club, so we love it.
Yeah. So after our mentor program, we offer a class called Coffee Club, where people who have completed the program can meet and continue to discuss and have conversations and share strategies and health and wellness routines with each other. So then we're also creating a new program through NICPAD, which focuses on mental health and wellness for people with disabilities. And through this program, we'll have a base program and also a Mindfulness Mondays portion as well. And through this, we will focus on improving the health and well-being of people with mobility limitations. And we plan to meet for 4 weeks and to meet twice a week. And that includes an 8-week module discussion. And also Mindfulness Mondays will be free as well. And we want to increase the quality of mental health tools and resources among people with mobility limitations. And we plan to meet twice a month for 1 hour to share tools and strategies to support mental health and wellness. Next slide, please. So within our base program, it will include 8 modules, and it will focus on defining what mental health and wellness is, the benefits of caring for your mental health, coping with daily life stressors, and also focusing on coping strategies for chronic stress, depression, and anxiety. And we'll also go over the My Scorecard and mental health as well as acknowledging the warning signs of mental distress and ways to reduce stigma and discrimination. And we'll follow up and complete it with a module on connecting, which includes community support groups, social media, apps, and resources as well. Next slide. So we also provide some disability and mental health resources through the CDC that focus on coping with stress. There's also information on disability and healthy living, the National Center on Disability and Health Promotion through the CDC, and also the National Center on Birth Defects and Developmental Disabilities as well. For finding treatment, they also provide a few resources known as findtreatment.gov, where you can find a provider to treat substance use disorders, addiction, and mental illness. And there's also the American Psychiatric Association Foundation, where you can find a psychiatrist, and American Academy of Child and Adolescent Psychiatry, where you can find a child and adolescent psychiatrist, and as well as the American Psychological Association for finding a psychologist. And they also provide a resource known as How Right Now through the CDC that provides resources on dealing with mental distress and all the different emotions that you can go through, such as grief, loss, stress, sadness, and so forth. And it's important to acknowledge our crisis hotlines. If you're dealing with mental distress or suicidal ideations, it's important to call 911 in case of an emergency. And we also have some national hotlines known as the National Suicide Prevention Line, where you can call 1-800-273-TALK. We also have a crisis text line where you can text SIGNS to 741-741. That is a free counseling services, and it's 24/7 and it's completely anonymous. And then finally, we have our disaster distress hotline where you can text or call 1-800-985-5990. Next slide. So finally, we have some mental health resources, both nationally, local, and some hotlines that I mentioned earlier, and mental health apps that you can use. And if you want to learn more about these resources, you can scan our QR code up here, and afterwards I'll be handing out some mental health resource packets as well with this information. But just to briefly go over some of our local resources here in Alabama is the Alabama Department of Mental Health, UAB Center for Psychiatric Medicine, our UAB Community Counseling Clinic. We have JBS Mental Health Authority, Hillcrest and Behavioral Health Services, NAMI Alabama, which provides a support group for those suffering from mental health distress in our community. Wings Across Alabama, Pathway Healthcare, Capital Care Alabama, and we have a crisis center in Birmingham as well. And Choices of Alabama, and of course, NICPAD, ourselves, the National Center of Health, Physical Activity, and Disability. Some of our national resources that provide mental health information, education, and activism. We have our National Alliance on Mental Illness, the SAMHSA organization, such as SAMHSA Substance Abuse and Mental Health Services Administration. We have Mental Health America, our NIH National Institute for Mental Health. We have our American Foundation for Suicide Prevention, Active Minds, and JED Foundation for young adults and adolescents dealing with mental distress or illness. And we have the CDC and World Health Organization, and of course, NICPAD again, and our crisis text lines. Thank you again. And does anyone have any questions? All right. Yes.
Criteria as far as the participation in the mentor and the other program?
So for NICPAD, our mentor program, it is completely free, and our eligibility requires that you be 18 years or older, and you have a recently acquired disability or an existing disability with a new secondary diagnosis or chronic health condition. And it's you also are required to have internet access because the program is completely virtual.
Thank you so much. And you want to tell about what's available at UAB and kind of how somebody would get in for services through the health system?
Sure. So first I want to talk about a little bit of the referral reasons, because we as psychologists know that not everybody knows all of the services offered through UAB and even other websites that I'll mention further. And then I'll also just provide some pro tips to getting in to see mental health providers. So some of those reasons that people can get in to see a psychologist is, one is depression. But what does depression really look like? So that can be a loss of interest in activities that you previously enjoyed, or frequent crying, irritability, change in your daily activities, so sleeping more or sleeping less, eating more, eating less. Another thing is anxiety. So anxiety is that fear avoidance. It can be restless or fidgeting or poor eye contact. Another thing is this phase of life transition, what we're talking about, so the emerging adult into adulthood. This is something you can seek psychological care both as the caregiver and as the emerging adult. So things that you would be able to look at is boundaries. So what makes sense for the new independence or newfound independence, and then also with the caregiver, that can be things like empty nest syndrome. Another thing is an adjustment disorder. So that can be an onset of a new illness, and then it causes distress in your everyday life. So that can be behavioral or emotional distress, and that has to occur within 3 months of the onset. All right. And then other things are just behavioral management referral reasons. So that can be anger management or attentional concerns, so help with creating calendars or focus and attention. And then something that I heard earlier was also pain. So pain management is something that psychologists can also help with. All right. So we also offer testing, so that's neuropsychological testing as well as psychological testing. So that's with the thinking part, the cognitive aspects of testing, which can help with IEPs, accommodations in the workplace or in college. All right. So how do we go about finding mental health providers? We can all recognize that there is more need than there is psychologists, so I definitely recommend starting early. And then the first thing I recommend doing is finding who is paneled with your insurance. So looking at that 800 number on the back of your card or searching online to find who is within your network. Because we all know money matters, and so we don't want to add additional costs or expenses if we don't have to. And then in speaking of underinsured or low insured, underinsured providers, or a website is Psychology Today, and you can filter it by sliding scales, which means that people offer lower costs based on need. And then you can also search based on disability or different factors such that I talked about earlier, like depression, anxiety, and those things. And as mentioned earlier, you said the NAMI, the National Alliance of Mental Health, they can also help for underinsured. Okay, so just in terms of a few pro tips, I just want to remind people that just like with your primary care doctor or your primary care physician, if you don't mesh well with your psychologist, don't just fall off. Go and find another psychologist. You can find one that works with you, and you can also just have an open conversation with your psychologist in terms of talking with them. Maybe there's things that they can help you with, or a person that they can refer you to. And then just in terms of telehealth and in-person, make sure that's an open discussion with your provider. If you want it to be via telehealth, talk to them about that. Or if you prefer in-person, also talk to them about that. And I think that's all I really have for today. Is there any questions for me?
All right, and Miss Melissa, we are going to go to you now, and I call Melissa like my resource queen because she came into the step clinic the first time, and I had been kind of banging my head. I'm like, where do I find this resource? And I need this, and she came with like this manna from heaven of these purple folders that have like all the resources for the state. And so I am so happy she's here and can share her wealth of knowledge with you.
First of all, I would like to tell everybody about HIPAA because you probably have never heard of that. It's been absent in Alabama for about 20 years, and they're just bringing it back. And I'm part of the inaugural class, so is Veronica, probably some other people that are here. But what policy and policy making Alabama is a leadership program that's designed for people with developmental disabilities and their families. In this program, we learn not only leadership skills, but how to advocate with senators and representatives. They actually are coming into our classes, and we're practicing so that we can go up to DC if we have to, or in Montgomery, and advocate for changes that we need as parents with some of the policies. This is open now for parents or any person with a developmental disability to join. So I want to tell you that first of all. It's been a great experience. I will tell you that the program is 9 months long. 9 months long. We've been all over Alabama. You have virtual training classes once a month on Wednesday. Every other month, we're traveling somewhere in the state of Alabama for classes that are Friday and Saturday. Every other month that we're not traveling, we have virtual classes on Friday and Saturday. It's a very intense program, but I would recommend it to anybody that if you have the time and want to take that next step in your advocacy, to join that program. Secondly, the purple folder. She was talking about the wonderful purple folder. I better tell you one other thing. The Partners in Policy Alabama is 3 different groups funding that. That's the DB Council, USEV, and ADAP. So they have come together and they're called the DD Network. So if you hear that, you know what that means. The purple folder, if you call the Department of Mental Health, this is one way you can get the folder. Can you hear me if I hold this down? Because I think I can. Can you hear me? Okay.
Can everybody hear?
Can you hear me? Yeah, okay. Within the purple folder are all these wonderful resources listed out. The difference is if you call the Department of Mental Health, inside this folder, because they're going to ask you what county you're calling from, there are going to be resources in that folder for your county. So that's the new thing. They used to just give you the purple folders, but now when you call, if you live in Jefferson County, Shelby County, there will be resources that are just for that county. So that's the newest thing about the purple folder. I did a resource fair as my PIPA project for a rural part of Alabama, and over there on the table is a whole bunch of stuff from Social Security, talking about SSI, how do you apply for it, once you get the benefits, if you work, how that affects your benefits. I would recommend for sure to get this red book, because it's like my Bible for my son, Daniel, who's over there operating the camera right now, and understanding SSI. I would definitely pick these up and keep them. I had to wait 3 years before Daniel qualified for SSI, and I kept these things in a folder for 3 years. Because you just never know when you're going to need these resources. So the things you pick up today, hold on to them. The muddy water will become clearer as further you go along in your process. If anybody else wants some other resources or things you may know about or need to know about, please ask me. I can tell you about Alabama HIP, if you've never heard of that. Have y'all heard of that? Are y'all using that? Okay, that's out there. So if your child has SSI or Medicaid, then and they're on your personal insurance, your premium can be paid. They got a calculation, so I said can be paid by the state of Alabama for your whole family, not just for the child or the young adult that's disabled. So if you haven't heard about that, go check that out. Alabama is a tourism. Okay, tourism. Right now, you can go on there and they got a new program where if your child or young adult has sensory issues, they have provided packets in different hotels around the state of Alabama, fidget toys, quiet rooms, just a whole bunch of things to try to make your stay in a hotel pleasurable. Like express check-ins so that you don't have to wait in the line, things of that nature. But they also, right now, and I'm spilling the beans, right now, where you can go and sign up, go to their website and sign up for a one-night hotel stay for free. Okay, I know. So because they're trying to launch this program and find out, getting feedback from parents. So they're doing that so that they can get feedback from parents. I'm trying to think of some of the other ones. That's all that I have right now. But maybe if you ask questions, I can come up with some others.
All right, does anybody have any questions?
I just wanted to make sure everyone knows that we do have these handouts, where the one that Kalani was presenting, and it has in here like full descriptions and contact information, phone, email, websites, and so it shows it for local resources as well as national, and the crisis lines as well as some apps. So I feel like it's a really good and specific for mental health and inclusive of disabilities. So plenty of those, and that if you scan the QR code, you can go to that and we'll continuously update that.
Oh, I forgot one.
Yeah.
I'm sorry.
No, you're good.
In the purple folders that are over there, I heard somebody asking about charting the life course. There's actually copies of that in the purple folders over there as well.
And that was what Colby's Act they were talking about?
Well,
building a care team?
Mm-hmm.
Okay. Yeah, so Melissa's got some of those resources as well. And if you're not taking advantage of Lakeshore, certainly if you live here locally in Birmingham, please go check out the campus and go spend some time over there. It really, I could listen to Jim Rimmer talk all day, and in fact, whenever I can just sit down and have a cup of coffee with him, I'm so inspired about mindfulness and just, making the most out of the time that we have here. And so, but you guys made the most out of today, and you really made today very special for us. It was important that we brought this conference back. I think it's going to continue to grow. I'm excited about how many people are also watching it online. But you guys had to be here present for us to put it on in order for people to also have it online. So thank y'all so much for being here. And again, about the CEUs, you'll be sent an evaluation. Make sure you do that evaluation, and then they'll send you the certificate from the CME office. But if you have any questions about that, I think most of you know how to find me, but I'm Betsy Hopson at Children's or UAB, and so I'm pretty easy to find. All right, thank y'all.